So the answer is 91% of seniors are using a cell phone and 61% are using a smartphone. And the point here is know your audience. So the senior population is diverse and complex. And if you don't understand your audience, you're going to miss those opportunities. So for folks who are surprised by that statistic, seniors are using digital channels, and that train has left the station. So if you're not incorporating them into your Medicare communications, get on board. It's a great addition. And for those of you who are aware of this digital adoption in the population, that's fantastic, but there's even more that you can do. So often we do focus groups with seniors at Engage Us, and it helps us gain insights that we wouldn't otherwise get. For instance, seniors actually welcome communications from their health plan, and that's not the case for every population. So if that's news to you, it might help you rethink your strategy a bit. And in cases where you may be struggling to get to know your audience and to get to those insights, we've seen seniors complete surveys at a rate of nearly 2 times what folks under 40 will do. So if you have some burning questions, find a way to ask. If you can unlock those insights and you can understand your audience behavior a bit more, it can really help to inform your segmentation strategy. So Drew, I know this is one of your favorite slides too. Is there anything else that you want to call out here?
Well, I guess one thing, there are a couple things. So one is you're mentioning the survey, and if I'm again mapping back to what the member engagement, member satisfaction mechanism of measurement is within STARS, it is going to come back to surveying in many instances. So the opportunity is ripe for those things to align. And I think the other points that are brought out here, so whether we're looking at gender or other demographic or geolocation, I think my main takeaway is that this is not a monolithic population. This is not a singular point of view. So learning more of what works with whom, I think if that's not central to what's going on from an engagement perspective or how we're using tone or voice with that population, then almost invariably we're leaving something on the table, because the areas where they have an affinity or have an aversion are pretty pronounced. And if we gloss right over that, it's a population that's going to notice.
Agreed. Great. Next slide. So the example we're looking at here for segmentation is addressing colonoscopy. The point here is that it's not enough to simply pull a list of members that need a colonoscopy and send them the same communication. If you do that, you're missing an opportunity. If you look just a little bit deeper at data that you already have, it will tell you who's missing a primary care physician or who hasn't had a well visit in the last 12 months. And these are likely barriers to getting the colonoscopy. So we know that members who have a PCP and are seen regularly are more likely to complete other health actions such as preventive screenings. So it's really critical to start with behavior, then focus on driving the right action. Relatedly, if you go to the next slide, Drew, unless you have a comment on this one.
No, I don't think so.
No. Addressing barriers works. We've seen it firsthand with impressive numbers across a variety of campaigns, and I'm highlighting some of those here, but I don't want to mislead you either. I think it's important to highlight that these results are possible, but you should know that small, steady incremental gains are just as important. What we saw in 2021 STAR ratings was that over 65% of plans missed hitting the 4-star threshold in CAHPS, HOS, and HEDIS measures by just 1 to 2%. So next time you're considering if it's worth the effort or investment, take a closer look and be ready with the right tactics, because addressing those barriers can really help move the needle. So what kind of tactics can we use to drive engagement? How do we get folks to take action and push through those barriers? Covering that in the next slide.
Yep. Adrian, can I actually put you on the spot just for a second when we have
Sure.
the barriers conversation? I think it's easy for us to get a short list of what the barriers are in mind and have those be, oftentimes we're thinking about maybe internet access, or we're thinking about physical proximity to a provider. But could you just open up a little bit more on those barriers, maybe things that we from a health plan perspective don't see, but from that member's perspective, it's pronounced?
I mean, some of the more common barriers that we hear, especially around things like preventive screenings, or taking a particular action to close a health gap, are things like, I don't have time, I don't have transportation, I didn't know I need it, my doctor hasn't communicated this to me. And so there's that kind of go-to list that we use, and having some snappy responses ready is what helps to get members more comfortable with the idea of actually taking action. They know they have a partner, they know you're there to help. And if you can already address those barriers, it kind of squashes them. And then they can sit back a little bit and go, oh, all right, well, maybe this won't be so difficult. So it depends on what the action is that you're trying to get them to take. But very often it's easy to collect those barriers and understand what they are, and then use that information to come up with some responses, whether it's, agents that are doing outbound calls, or if you're sending out IVR, having that programmed in, or even addressing those barriers in a print communication or an email proactively to make sure that members know there is help if they need it. It's a powerful tool.
I mean, sticking out to me is also the idea that there may be just a healthcare IQ barrier on some of these things. So if we from a health plan are saying there's so much value associated with a colon cancer screening, but where that member is they haven't even signed up for the portal yet, or they might not even have that PCP. So just thinking about in the context of, I'm about to send something to someone, am I meeting them where they are, or am I assuming they're 4 steps ahead of where I'm trying to lead? Yeah.
Exactly.